all these names popping up in today's group meeting. Like Karen shared, we are excited to share with you about two new resources that are available to support parents, caregivers, and children ages 0 to 12 and 13 to 25. I am here with our partner in crime, Celeste. And Celeste, you want to say hello before we jump into the presentation?
Yes, hi everyone. My name is Celeste Gassio. So I am representing Saluna. I actually come from a special education background. I used to be a SPED teacher and also a coordinator with SPED department for 10 years. So really excited to get to share more about our platform and answer any questions you have along the way.
Thanks, Celeste. And I will kick off the presentation. Celeste will then share about Saluna. But like I mentioned, I am Claudia Estrada. I am the community engagement lead supporting the outreach efforts here in the Inland Empire. Some of my little background, I came from early intervention supports, primarily focusing on the 0 to 8 age group. So are super excited to really connect with families, support children, and here today to share about Bright Life Kids. Celeste, you want to share full screen?
Yeah, let me see. Did that do anything or should I try resharing a different way?
I could see your tabs on top, but it's okay if you can't expand it to full view.
Okay. Yeah, I think that's what
Okay,
it's, yeah.
it's okay. Sounds good. Go ahead and move on to the next slides. So we're going to start off by sharing Bright Life Kids with you all. Bright Life Kids is a CalHope program. Our organization is called Brightline, and both Brightline and Kooth was selected from over 450 vendors to provide these behavioral health virtual platforms. We were excited to be partnered with the Department of Health Care Services, and we are one of the work streams through the Children and Youth Behavioral Health Initiative. Again, diving more into the details about Bright Life Kids, but we are so excited to have launched as of last year in January. So we've been in the community supporting all California families for a year now. Go ahead, Celeste. So what is Bright Life Kids? Bright Life Kids, we offer virtual behavioral coaching for any parent, caregiver, and child 0 to 12. Our services are absolutely free, so there's no cost, there's no insurance required, and no referrals needed. Um, Regardless of immigration status, or income, any California parent, caregiver, and child 0 to 12 can access this support. And what we provide is the opportunity for parents and caregivers to connect virtually, like we're doing now via Zoom session, to a behavioral coach. So it's individualized support to provide strategies, tools, and ideas on how to better support their child's behavior and social emotional development. And so, with that, parents are able to have conversations with experts to really get different ideas on how to support in different areas, inclusive of developmental milestones, social emotional regulation. Maybe it's parents are needing support with routines around sleep issues and patterns. Most importantly, too, is supporting the parent and child really navigate those big feelings and emotions that we all experience, like sadness, worriness, anxiety. So, again, any parent that has questions, concerns regarding behaviors, inclusive of disruptive behaviors, tantrums, getting your child to school on time, supporting with access to social media, technology, you name it. A coach can connect one-on-one for those supports. Go ahead and click to the next slide. Our coaches are bilingual in English and in Spanish, and we also have a live translation service support in the 17 additional languages listed here. So again, because we support all of California, we want to make sure that we are connecting with the parents in their home language. And we also have materials available in some of these languages listed here. Next slide. So what makes our coaches, the experts in the field that they do. So all of our coaches either have a master's degree or a bachelor's degree in a health related field. But what makes them coaching experts is that they have to have a coaching certificate, and they have at least 5 years minimum working with families before working with our Bright Life kids. They all come from very diverse backgrounds, and they either have lived in experiences or receive additional training to support our communities, such as our LGBTQ plus and our BIPOC, Black, Indigenous people of color. Next slide. How are the services delivered? Again, one-on-one virtual support for parents, caregivers, and children. And so how are the services being seen? For the first 6 years of life, we are really focusing on supporting the parent and caregiver through the use of the parent management training model. Again, we are providing those supports, the strategies, the techniques, all tailored based on the child's age, their temperament, even the family dynamic, again, to provide optimal and achievable outcomes. Once a child turns 6 years old age, they're able to be part of those coaching sessions. And we take a dyadic coaching approach, meaning that the child can be part of those conversations with the coach and the parent, of course, with the consent and making sure that it's an appropriate fit. Which is great. It's amazing because, as you may all know, children between ages 6 and 12 or older than 5 years of age typically have better communication skills and are able to express or share their feelings more. So we want to make sure that they can be part of those conversations if the family feels it's appropriate. And what that means is that the coach is giving the parent and caregiver strategies, but also providing those supports directly to the child. And again, all based on their age, their temperament, and family dynamic. And then throughout the 0 to 12 age range, we are also providing digital tools. So families can access a library of digital tools 24/7. And I'll go more into detail about what those tools look like in the next couple of slides. We always want to make sure we differentiate how we fit in the care delivery model. Bright Life Kids is subclinical support, so we are preventative and early intervention. Here you see on the top of our triangle our clinical intervention supports for children needing either therapy, counseling, and diagnosis. So they are receiving clinical interventions. However, we know that not all families need that level of support. So we are here to really connect with parents early on before it escalates to that level of acute care. And again, we're able to really provide those simple everyday strategies to support those behaviors and big emotions that we see throughout the 0 to 12 age range. And that can be inclusive of separation anxiety, relationship stress, conflict, communication skills, and so much more to really hopefully build those self-confidence of not only the child, but also the parent and caregiver as well. So what do families get when they get in contact with Bright Life Kids? So coaching is what we call our primary support and service. However, families can still access a variety of different supports. We have digital tools, and this consists of a library of on-demand digital content like podcasts, articles, exercises, videos, all tailored to support the age of the child and also the need that the family identifies upon registration. And again, these tools are available to view 24/7. We hope that all families would love to connect with our coaching supports. And there's 3 ways of families to get those coaching services. Virtually is an option, so they connect via Zoom, one-on-one. They can also text their coach using a secure text feature, or they can also have a phone conversation. The goal is for families, again, to feel connected, to feel supported, and receive that individualized strategies and techniques to support their children's behavior and everyday emotions. Next slide. Our families also have the opportunity to connect with our coach specialist if additional needs are being shared throughout these coaching supports. So if at any point the family needs additional resources, external resources, our coach specialists are able to provide them with those resources and link them back to the community for those supports. And that's inclusive of basic needs. Maybe we have a family that shared with us that they are experiencing food insecurities or housing insecurities, or maybe upon an intake session with the coach, it is identified that the child would benefit more with getting connected to therapy or counseling. Our coach specialists are providing the resources that are appropriate for the family. And then they're following up to make sure there has been a connection so that the family is being supported. And last but not least, we just launched our Bright Life Kids communities. These are peer community platform where parents have the opportunity to connect with other parents. This is a secure communication forum where they're able to ask questions, ask support when it comes to coaching. We are moderating this different chat options, and our coaches are also able to share content, to share simple strategies for these parents. So it's a way to build community, to build communication, and there's different groups the family can connect to. We also have a Spanish speaking group as well. So if you know of any parents that are looking to get connected and build that community with peers that have children of the same age, we can always encourage them to join one of our Bright Life Kids communities. And again, this is all virtual. So you may be asking, how do parents get started? Registration is really simple. We encourage parents to just register by visiting our website. Here you see is the homepage. So when parents click on our website, they can toggle between English and Spanish on the very top of the screen. So just know that if a family prefers that information to be translated into Spanish, they just click Spanish and all that will be translated into that language. And then parents just have to click on the sign up for free yellow button that you see here. Once they click on that button, the next screen will show and ask for their email and password. We want them to create a secure access to their account, and this is where they will be able to join those peer communities. They will be able to text their coach using that secure text feature. They will be able to schedule and connect virtually to their coaches, and also be able to explore that library of digital content. Once they enter their email and password, they will be asked on the next slide to enter their first name, last name, and zip code. It's important for us to gather that information because, again, this program is free for all California families. And then on the next slide, we will just be collecting the child's name and age. It does not have to be the child's legal name. It could be a nickname. And we ask of this because we know sometimes parents have more than one child. And then we also ask for their age because we will be asking them to complete a short questionnaire that is appropriate based on their age and development. Families complete this questionnaire. It takes about 3 to 5 minutes to complete. And once they submit it, they will be able to select the coach of their choosing. So the coaches are able to connect with their families. They are able to read the coach's background, their specialization, and then click on their availability to be able to schedule that first session. Our coaches are available Monday through Friday from 9 a.m. to 8 p.m. And typically there are 30-minute sessions weekly that families are connecting for support. Okay, so here we have our referral link. I know I mentioned that no referrals are needed, and that is absolutely true. But based on the feedback that we have received from the community and partners, we do have a referral link that can be utilized. What this does is you're sharing the family's information with us. We are generating an email saying that someone that cares about them wants them to know about Bright Life Kids. The parent will still have to open the link and complete the registration process, follow all those steps that I just shared with you in order to be connected and start their coaching supports. What we like to use this for is, we know that it takes multiple touch points, multiple reminders for parents to connect to resources and supports. So this could be a warm way of making that reminder for them so that they know that Bright Life Kids is here to support them when they're ready. Next slide. Okay, so now I just want to provide you a short visual of just what our coaching services look like. Go ahead. Oh, you're gonna have to share your audio, I believe. Not hearing it, Celeste. So if you are able to, I
You're
think you
not
might have to
hearing me.
reshare your screen
Okay.
and then select audio right before you reshare it.
Okay. Let me do that. So reshare, you said, right?
Yeah, and then it says share sound. Once you click on that icon, you can then reshare the screen.
Okay. I will remember that next time. Okay, and then I'll press play now. Okay.
Perfect.
Childhood is filled with lots of big feelings. So is parenthood. Big feelings aren't one size fits all. They're different for everyone, for every infant and toddler, every kid, every tween, and every family. Bright Life Kids can help you navigate those feelings with free personalized behavioral health coaching and tools created by experts for families with kids ages 0 to 12. Live video sessions, secure chat, and on-demand tools are now at your fingertips when you need it most. Throughout every stage of childhood and parenthood. The best part? Thanks to our partnership with CalHope, Bright Life Kids is available to all California families, regardless of income, at no cost. It's really 100% free, no insurance or referrals needed. We're here for the tough stuff. From worries to tantrums, to making friends, to managing screen time. Bright Life Kids is your partner in parenting. Access to free, high-quality behavioral health coaching is finally here for California families. And enrollment is fast, easy, and secure. Get all the tools for all the feels. Sign up for free now at brightlife.kids.
Sometimes it repeats itself again. Go ahead. It does that at times. Okay, so here is one of my favorite slides just because I love to share the impact that we are creating in this entire state. Since we launched in January of last year, we have been able to register over 89,000 children, of which 15,000 of them have been able to connect for coaching sessions. So 15,000 coaching sessions, I'm sorry, have been conducted the past year. Again, we're just so excited because we want to partner with schools, with organizations like yourselves, to be able to, again, share the information. And we are making that impact. We're connecting with the families. We're providing the support that our young children and families need. Next slide. Okay, so how can we partner with you to share the information with your families and your community? We really would love for you to utilize our digital toolkit. I know Karen has been amazing at dropping in that link for that live binder. In that live binder, you will find our digital toolkit where you would be able to see the different materials that we have. But please feel free to feature all of our flyers and materials if you have any newsletters, whether it's for parents, whether it's for your own organization. Maybe you have a website and you want us to feature our information there. Or if you're looking at having flyers available to share in your resource packets, please let us know how we can support you and collaborate. And I'll show you the materials in the next slides. But if you are wanting any of these informations sent out to you, I can definitely mail out some of those flyers to your schools, to your community, to your organization. We hope that you also invite us to your in-person events. So if you have any upcoming events, here we have an example: back to school, coalition meetings, healthness healthy wellness fairs, we want to be part of that. So I am the community engagement lead. I'm interested in being out in the community, connecting with your family. So if you have any upcoming events, please reach out and I would be more than happy to see if we can support. I'm also available to do presentations like this to your staff or parents. I do speak Spanish. So know if you have a platform, if you have an upcoming staff meeting, I can do this presentation for your team so that they can feel more comfortable knowing about our program and sharing it as a resource to the families you serve. And last but not least, I would hope to have a follow-up meeting with you all. You can go to the next slide, Celeste, it's okay. A follow-up meeting. So my information is going to be available to you all. So if you want to connect to see how we can further support, I know you know your community best and the families you serve. Feel free to reach out. We can have a quick, brief connection time to see how we can further partner. These are some of the materials that are available to you. So again, they're available on the Live Binder. But if you are interested, let me know and I can mail these out to you. And then last but not least, we are also offering what we call our monthly webinars. These webinars are open for both parents and professionals to attend. They happen every month and they change in topic. This one's going to really highlight the importance of ACEs and Black mental health. And so we are excited to have you join. I believe the flyer is also in the Live Binder and it has a QR code for you to scan and register. If you're not able to attend the live recording, that's okay. The live session, we will email you the recording if you register. So just register, we'll email you the recording for you to share with your team, with your staff, or with families that you feel would be good to receive this information. The next slide, I think we're good on time still. Yes. Okay. So this kind of concludes the Bright Life Kids portion of the presentation. You have my email here listed again, but this is our website, our phone number. If families need any support in connecting, they can always contact our toll-free number listed here. And we have a customer care team that is able to walk them through that process of registration and answer any questions. But because you are here with us today, I would love to encourage you to get a sneak peek of what it looks like to explore Bright Life Kids services. So if you have a smartphone, you can scan this QR code. It's going to ask for your zip code, the ages of your children, and your email, but you're not registering. And then it's going to open up and you'll be able to see a video of Coach Brando sharing about the coaching experience. You'll be able to view the library of digital content, an example, again, because it's not tailored based on your needs, but then you're able to see where parents can click on to schedule connection time with their coaches. And just for you to know, once you click on that link, at that point, you would have to register. But this is just an opportunity for you to become familiar so that you can feel more comfortable sharing this resource with your families. And with that, I'm going to hand it off to Celeste. Celeste is going to go ahead and share about Soluna, and then hopefully we will have time at the end for your questions.
Thank you. Hi, everyone. So I get to share about Soluna, our digital mental health platform that's available for 13 to 25-year-olds here in California, all thanks to the Children and Youth Behavioral Health Initiative. So we were selected out of 450 vendors to represent that age group and provide different layers of support around mental health and wellness, which I'm very excited to share. I'm going to give you just a little quick background of Kooth, the company behind Soluna, so it gives you an idea of who we are and why we're here today. So I love sharing this background that Kooth was actually born out of the belief that mental health support should be accessible to all, especially starting with our young people. It was actually a counselor and an internet enthusiast who were sitting at a kitchen table, really contemplating like, how can we help support in the mental health field, knowing that this internet is going to be a big deal. And so it started off as an anonymous email service in 2001. And then 20 years later, Kooth is the #1 digital mental health service in the UK. And it's really important that we share the strong evidence that we have to back up what we're doing. So I know this is actually the presentations included in the live binder, so you can actually click on the link to explore our research as well if that's something that is of interest to you. Really quickly, we provide the early and responsive support at a population-wide scale. So really focusing on early intervention and prevention. We're more of that upstream service, wanting to reach youth where they're at. So if that's education, healthcare, social media, we've noticed a huge jump with our engagement with youth and young adults when we started engaging in like that digital marketing. Some of you might have seen us like on Disney Plus or Amazon Prime. I know I went to the movie theaters and I saw Saluna on the big screen, which really excited me. And so we really want to equip and empower our service users to prioritize their mental health, giving them guided resources, coping tools, peer support, professional support. But we also recognize we're not a one size fits all. So we actually help with warm handoffs to higher acuity care through community resources, crisis services across our 58 counties. As I mentioned earlier, I do have a background in special education and have lived experiences with mental health. So I've seen the challenges of navigating traditional mental health systems. And I really love how Saluna values in making support very instant, without any barriers at no cost. So this really has been like a resource for a lot of our youth and young adults, more like a lifeline for them when they're facing moments of stress or uncertainty, much like what I'm sure we have all experienced when we were 13 to 25. I know that was a pretty rough transition for me, and I'm now in my 30s and feel like I'm barely figuring it out. So I love that we're really supporting this age group. And I'm so excited to share a little bit more about the platform in a bit too. But really quickly, our approach is really centered on youth. So valuing their lived experiences, fostering community through peer support. We do use evidence-based methods, really to help our individuals align their actions to their personal values and strengths. We have rigorous clinical oversight. It's really focused on a goal aspect versus in the single session model, wanting to be consistent in our services, high quality support, and wanting to provide meaningful outcomes for our service users. I like to note that we do record every interaction that our coaches have. So we do regular audits, we provide timely and specific feedback, and we have the I respond model that we incorporate as well. So every coach is reviewed on a quarterly basis through this. Um, Based on that audit, we now acknowledge what are their strengths and what are some areas we can give more training for areas of growth. Peers provide feedback, supervisors provide feedback, really wanting to help practitioners be the best versions of themselves and wanting to make sure that any service user that engages in the coaching feature can be confident that they're receiving the same quality services. But I want to give you a background in the data and research because it really does guide everything that we do. We are proud to say that we developed the first validated outcomes measure, the SWANM. And so this is a tool that highlights the importance of goals over symptoms. We found so far that not everyone wants to commit to consistent sessions. There are people who really prefer the drop-in option. So choosing to engage in those coaching sessions whenever they feel like it or need to. And then I'm going to share later on some data on that as well. But this is where I get to tell you more about Saluna. I personally love to share that it really is innovative and accessible and helping our youth and young adults transition into prioritizing their mental health and starting their mental health journey. So this is what it looks like. I also love the fact that when we did our soft launch in Stanislaus and San Joaquin County back in the fall of 2023, we actually had 300 13 to 25-year-olds help create the platform. So they came up with the name Saluna. They came up with the colors purple and yellow because they found it very calming. They chose the constellation theme, and I love the constellation theme. You'll be able to get access to the demo to explore it later as well. It's really fun to navigate. But also, I just remember being in that age and being obsessed with outer space and loving to look at the stars and finding that a very calming thing. So I like that that was incorporated. We also have a youth ambassador program that we just launched this month. So we have college students who are working in a paid internship. They provide feedback on the platform. They're supporting and promoting it and sharing how it's quite normal to struggle at times with your mental health and that there's a way to be proactive and empower and equip yourself to make it a priority. I also like to share that there's no subscriptions, there's no ads. We just ask for their zip code and their birthday. So we want to know they're in California, they're 13 to 25, um, because we kept getting the same feedback through that soft launch as well, that our youth and young adults really appreciate the anonymity piece of it. So the platform is anonymous. We only ask for those two pieces of information. They can put their email account if they want to access our other features. We are now not just on iPhone and Android, but also on the web and tablet. So that meant a lot as a former educator, because I know not everyone has cell phones, and Chromebooks or tablets that they get from the school might be their only access to technology. So this is a way for them to access Soluna as well. So we're really focusing on that massive missing middle. We know that a lot of our young people don't have a mental health diagnosis, or they might not be facing immediate crisis, but they are struggling with preclinical, emotional, social, and mental health challenges. So we know we're wanting to meet them where they're at and help them start that mental health journey. It's a really great alternative for those who prefer to be in person, aren't looking for something consistent, and so they can choose however, whenever they would like to engage in the platform, but really wanting to focus on our service users building their toolbox and building on those essential life skills, wanting to get them the help that they need. I always think back to like when I was in college and what a struggle that was. I was having a hard time navigating having a job, trying to have a social life, going to school full time, and also just having my own difficulties with mental health, but it wasn't something I shared with my parents. So if I would have had something like this, an anonymous space to talk to peers, to talk to coaches, learn more content around mental health and wellness, I would have really loved something like that. And I'm sure some of you can also relate to that too. Um, what you'll see when you look into the demo is that they have access to self-guided resources. So that's really focused on fundamental practices like goal setting, self-regulation, breath work, personal reflection. A lot of users love our thought shaker. So some of us remember that magic 8 ball. You would like shake it and something would pop up. That's like the thought shaker in our platform. You shake the phone and these positive affirmations pop up. That's been one of our top 3 tools since we launched last January. I've noticed a lot of students when I'm presenting out in schools, they love the noise cleanse. So they can pick different sounds to listen to. I always tell them, instead of doom scrolling on TikTok or Instagram at night, play the noise cleanse. It really helps transition you for bed and getting your mind and body calm. And then they have access to that peer support. So this is where they can actually post content, they can comment, they can like. In the constellation and the library, they can find different content and discussion boards, helpful articles, activities. Coming back from like the educational experience, I love that it has a multi-sensory approach. So they can listen to audios, they can watch videos, they can read text stories, there's quizzes they can take. In that forum, it's really nice for them to have a sense of community. Not everyone has a safe space to connect about these things, or not everyone's comfortable talking to their inner circle or the people they live with. And so it gives them that confidential digital space to be able to discuss, to uplift each other, to support one another. As a parent, I love that it's pre-moderated. So I'll get a little bit more into that safety feature in the next slides or so. They can also access, again, the coaching and journaling. Our coaches are available every day, including holidays, on the weekends. Our service users have the choice to chat for 5 minutes, up to 45 minutes. They can drop in, so whatever coach is available, or they can actually select a coach. So it really gives them the autonomy to choose who they want to have these conversations with. They can read their bios, learn their interests, hobbies, specialties. So if they're looking for someone who has experience with ADHD or anxiety or anger management, substance use, who's part of the LGBTQIA plus community, who's part of the BIPOC community, different things that they're looking for, maybe someone like them with the same experiences, they can choose to chat with that person, and they can keep chatting with that coach as well. They can either do text chat or video. We added video back in the summer because we kept getting feedback from service users that they were wondering, is this AI? And so we told them, no, it's not AI, they're real people. And so we added video as an option as well. And as you see here right now, our platform's available in English and Spanish, but we do have telecoaching available that covers all of the 19 languages under Medi-Cal as well. All right, So with our coaches, we do have highly trained professionals, including peer support specialists, mental health practitioners, substance use disorder counselors. They go through extensive training. They have background checks, like I mentioned earlier, continuous supervision, wanting to make sure they're providing that safe, compassionate, and culturally informed support. And also their experiences ranges from lived experience to advanced degrees in related mental health fields, but they're really dedicated to empowering youth and young adults with the guidance they need and the tools they need to navigate life. Um, Here is the safety slide that I was talking about. So it really is the foundation of everything that we do. We have policies in place to address any risks, such as suicidal ideation or self-harm. All of our user content is pre-moderated, like I mentioned. So that means it allows for identification and mitigation of risk before it becomes an issue. Not only do we stop inappropriate content, but we also like to reach out to service users to initiate a coaching session for assessment as well. I also mentioned with that pre-moderation, something I also like as a new parent is the fact that our peer forum is now there's an age gating in it. So we have two peer forums, one for 13 to 17-year-olds, and then one for 18 to 25-year-olds, just because we know people have different experiences during those time frames in their life. And so we want to give them that space to converse in a group setting amongst each other based on maybe those similar experiences. And I'd also like to share there's no one-on-one direct messaging between service users. So you don't have to worry that a 13-year-old is going to be talking to a 21-year-old or a 25-year-old on their own like they could on other social media platforms. So that is something I like to share. But really what we've learned is that our youth and young adults are very appreciative of having a space where it's non-judgmental, it's safe, it's inclusive, it's kind, and giving them that reassurance that they're able to feel all those things in a space when they're trying to access mental health and wellness support. And then I wanted to share, it says coming soon because this was previous in another presentation, but it actually just launched. We are having our well-being plans now accessible to our service users, so they will have access. We started putting well-being plans instead of safety plans because that was a feedback from service users as well. They're like, I'm not unsafe. I just want to engage in support or tools around my mental health and well-being. So we changed the name to well-being plan. It can be updated at any time by coaches, and then it is shared with the service users on the platform. That's a new safety feature that we have as well. And it has all their history in there. And then if there's any changes, they are notified. The service users notified as well about that. Our goal is really not to replace anyone because we cannot do that, but just wanting to coexist and be an augmentative support for everyone, whether you're in K through 12 or higher ed, in the community or a healthcare professional, offering Soluna either pre-appointment, in between sessions, or even as discharge paperwork. And so that would be our goal, to incorporate that with you and the work that you do. Here's the data that I wanted to share. This, I believe, is up until May. We have data coming in from October as well. It just gives you a little bit of a story of how Soluna has been able to reach youth and young adults across our 58 counties. More than half of our service users are engaging in sessions outside of the 9 to 5 p.m. timeframe. And this is just giving us insight on really the importance of being available for youth and young adults on their own terms. You can see on the bottom right, this is going back to that SWANM, the single session outcomes. And at 85% of our service users shared that they had at least one need met in a single session. I love this slide because it gives you all some testimonials from service users sharing how Soluna has helped them, getting to read through how they feel heard and seen and understood. It's just a great reminder of how important something like this is for our youth and young adults. I know I've read through a quote where a service user has anxiety, and they found that Soluna has been able to help them address it, come up with different or like multiple methods on how to support themselves with their anxiety. And one thing I thought was so huge was learning, they're learning how to forgive others and move on. And being someone who was diagnosed with anxiety in college, I will say that was not something I did not learn how to move on and forgive by the age of 25. That has only been something recent. So I just love that Soluna has been so helpful in that specific person's journey. Off platform, I want to let you all know that we do have care navigation in the safety section. And so they actually have support beyond just the platform. We go a step further and connect them to local services like housing, food, clothing, safety, dental, medical, whatever they're looking for, whether they have insurance or they don't have insurance. If they're undocumented, again, we really want to focus on that anonymity piece and wanting to make people feel safe. But we have Find Help, where we work across building different partnerships across California. So that way we're supporting with people knowing that there's services in their community that exist that can help them. So that is something that I would love to share with you all. If you're interested in being an affiliate network, we can add you onto there. But it's just wanting to make meaningful connections for them in their communities, giving them that full service. And we have our care coordinators available for them to talk to over the phone, to help them navigate the system and to support with navigating all these things, which I think is super helpful. It really takes the stress out of it for the service user. They're more than welcome to do it independently, but we have care coordinators to help them along the way. We also do warm handoffs, and then we do post-appointment check-ins to see if that service was beneficial or if they're looking for something different. So like I mentioned with that affiliate network, we're partnering with local organizations, giving our service users a wide access of support, whether it's career counseling, therapy, essential services, wanting to just be working collaboratively with our community-based organizations. So that way we don't have any youth and young adults falling through the cracks. As for next steps, like Claudia shared, we also would love to partner if there's any way you see fit. We do campaigning, we host events, we do joint events, we collaborate on research, on advocacy, whatever you're looking for, but just wanting to work together to really make a difference. And as you can see on this slide, this is really for, I know we have educators in the call as well, what it can look like, of how it can be incorporated during school, after school, driving awareness, continuous feedback. But this is the slide that I can share with you how we can hopefully drive awareness together. We have our digital toolkit that you can click into. It's in English and Spanish. You can reach out to my team, the partnerships team, and we can explore a partnership for your community. And then like Claudia, how she's a community engagement lead, we also have a team of community engagement leads. So I left their email right there because they can help you access further promotional resources, but also start booking any events that you have that you would love our team to participate in. So that is this slide here, well, you'll find that. And I left the link for you to click on solunaapp.com if you want to explore that as well. And then this is the demo link. So you're more than welcome to pull out your phones right now, or we can, again, you'll have access to this in the live binder. You'll see that the Android, the steps are so much quicker. You scan that QR code, and then we gave you a birth date to put in because you do have to put a 13 to 25-year-old birth date. This is the demo app. So this is for stakeholders to be able to explore and get the service user experience. And then our Apple users, one thing I like to remind people is when you download TestFlight, you really have to make sure you close it. So you have to swipe up and make sure that it disappears. And then you get to scan the QR code and create your demo account. And so just wanted to be mindful of that, because if you go to try to scan the QR code on the iPhone and it says redeem code, that means that you didn't close TestFlight. So just want to give you a heads up there. And it should be called, I think, like Kooth Serenity demo, I believe is the name of it. So that will give you access to the demo. All right. Maybe I'll leave that up for another 30 seconds and then I'll stop sharing and Claudia and I can answer any questions.
Thank you both for presenting. I think it's such an amazing and great resource for our community. Does anybody have any questions for either Celeste or Claudia? Feel free to unmute or put it in the chat, whatever you prefer.
Can we have the QR code screen up again?
Of course. Yeah, I will do that right now.
Hi, Celeste. My name is Sarah. Nice
Hi,
meeting you
Sarah. Nice
again.
meeting
I got
you.
to meet you at the Apple Valley Health and Wellness Network not too
Oh,
long ago.
awesome.
Yes, yes. So we do want to definitely reach out and connect with you so that way you can meet not only our unique health navigators, but also give us and provide us more insight in regards to Saluna.
Oh, beautiful. Thank you. I'm so excited. I met a few folks from IHP. I think even I reconnected with some people at the wellness conference back at Disneyland. So really excited to hear from you.
Yes, so
Thank
we'll
you for
be able to
being here.
connect soon. Thank you.
Awesome.
Celeste, we can see your messages.
Oh, sorry, I was taking note of that.
We have a question in the chat. It says, for Saluna, are the counselors licensed therapists?
Yes, so we do have licensed therapists and clinicians who oversee the team. And we also have senior practitioners who are there, who are always present throughout the coaching hours. So first it goes with the peer support specialists and mental health coaches, providing the service. And then if there's any imminent risks that are identified, then the ladder goes up for the people to get involved and help support. Thank you for asking that.
We have another question. Would you guys travel to Trona for a community resource fair? Oh, Marisol.
You know, sometimes I'm still learning where certain areas are. So where is Trona?
Trona is just outside of Ridgecrest, so it's considered the desert mountain region. So it's just outside of Ridgecrest would probably be the closest major city. It's 395. You just keep going for a while.
Okay. Yeah, if you want to contact, I believe that would be the CELs. So in the slide deck, you'll find their contact information and they will be able to support with any events. And I can just.
Okay, I did want to mention, I do go ahead and send an email, but I just thought I would ask through the chat just in case if it was like a hard no.
No, yeah, we have our team still across California. And so that is something that they will be able to help with. And I know they also appreciate if there's opportunities to speak or demo the platform, they love that because it gives them an opportunity to share, to navigate it with youth and young adults. So if that's even an option too.
Okay, thank you.
Sure. For Bright Life Kids, Marisol, feel free to reach out, email me that information. I am the only community engagement lead supporting the entire Inland Empire. So if my schedule permits, and we're also in the process of hopefully hiring some interns to really support being present in those community events. So reach out, let me know of those opportunities because we're still interested in hopefully supporting.
Thank you so much.
I believe I see, is that question for me about the anonymity? I think it would be me, right? Okay. So yes, our coaches do reach out directly to service users if they have evaluated any level of risk. And then we try to collect as much personal information as possible. Of course, it's up to the service user how much they're willing to share. But based on what we know, then we, if need be, try to get them higher acuity care or involve local authorities as needed and give them the information that we have received because our team is well aware that they are mandated reporters as well. If there's no PII available, then we provide resources based on their zip code because we do have access to at least that. That was part of their account creation process that they provided during registration. So again, we still adhere to all our reporting guidelines based on any local, ethical, and contractual requirements. Any other questions?
I did put in the chat a feedback survey, so we want to be able to offer webinars, continue to have these supports and services. So I did put a feedback survey in the chat, a link, and I will send a follow-up email. So all the materials from today, Celeste and Claudia's information is going to be in there, the PowerPoint slides, access to view and get a sneak peek. I always call it the sandbox. So you get to play in the app and see what it's all about. And you get to look at all the great materials that Bright Life Kids has available. So that'll all be in the live binder, but be sure to fill out the feedback survey so that we can share it with Celeste and Claudia. And again, continue to keep doing webinars that work for you guys. And we'll stay on until 3 o'clock if there's any more questions. But thank you everybody for attending, and please share the resource. It's such a great resource for our community.